Scientists around the world are currently working on potential vaccines to treat the coronavirus. Most of the drugs have already passed through phases 1 and 2, the next step, clinical trials. But medical doctor Alverston Bailey believes a vaccine may not be ready until mid-2021 because of the lengthy process involved in developing the drug.
It will, in fact, be limited in amount because the whole world is now involved in the COVID pandemic. And obviously, the countries where the vaccines are developed will ensure that their societies get the vaccines first once they're proven to be safe and effective.
He's doubtful about the effectiveness of a vaccine at this time based on the history of similar viruses.
COVID vaccines are a possibility, not a certainty. And the reason why I say that is because to date we do not have a vaccine for the common cold. And COVID vaccine is related, SARS-CoV-2 is related to the common cold.
Dr. Bailey was, however, quick to point out their benefits. But even when the vaccine hits the market, accessing it may be a challenge. His recommendation.
I like to use the term of an interim vaccine. The interim vaccine is my concept of preventing COVID-19 spread using social distancing and hand washing and mask wearing. Therefore, rather than dwelling and reflecting on a possibility that might not be realized, let us try and use an interim vaccine rather than the real vaccine at this point in time.
With your health report, I'm Shamila Pullen wishing you good health. The Health Report is brought